Thanks, guys, for coming back and finding me, listening, watching, however you guys get the content. I have a pretty cool guest. I actually have Bert Walpack here today. I'm sure a lot of you have probably heard of him or seen some of his stuff on TikTok or YouTube, but go ahead, man. Say hi and just kind of tell us who you are and what you do.
Yeah, my name is Bert Walpack. I'm a general dentist in Eugene, Oregon, and I do a lot of stand-up. I'm doing stand-up for about 10 years, and then just recently I kind of got into doing dental stand-up and dental videos, joke videos. Yeah.
I was gonna say, like, yeah, I've been doing stand-up for a long time. I just recently I got into dentistry. No, but it's the other way
Yeah.
around. You were a dentist first, right? Obviously.
I know I graduated college and I went straight to stand-up in New York City, and I was about 21, and I did it until I was like 24, and it was just
Whoa.
it's just real, not just competitive, but they're just so good out there. And I think I was expecting, when you're young, you have really high expectations of things just being handed to you. And I thought I would be on Saturday Night Live after 2 years, and I wasn't going anywhere. So I took a break from it. And usually, if you start in a city, they always remember how bad you were. So usually, you should start in one city and then go to another city if you want to make it big. And I should not have started in New York.
That makes sense. You started in like the worst place. So you didn't play like the Apollo or anything like that. You just kind of you
I
stayed in the city.
applied. The app. Do you remember? I don't even remember the application for the Apollo. It was at the end, so I applied with a video, but
Got
I
it.
don't think they. I wasn't. I would have gotten eaten alive. But I
So
also
when
have
you
like, yeah.
go ahead,
You just have so much confidence also when you're like 20, 21. Like, oh, I would
you're
kill there.
invincible. You're invincible,
Yeah.
man. And like when you applied to dental school, did you put all that in your application? Like I did stand up and I did this, or was it like a hidden thing at the time?
Yeah, I think I was really embarrassed that I didn't succeed in stand up. So I didn't really tell anybody that I used to do stand up because then they'd be like, "Oh, why'd you quit?" Or like, "What's your?" So I was pretty hush about it. And then
Got it.
it's usually if you tell someone you do stand up, then the first thing they want is a joke, and then the joke never hits because you're. It's not like a street joke. It's usually like,
Ah, well, that's true. It's too much pressure, man. I hate it. I hate that.
yeah. And then if you tell them like your best joke, and then they don't like laugh, you're like, oh, maybe that joke's really bad. But I don't know. There's just something about being on stage with a light on you and people there having drinks that it kind of frames it.
That makes sense. That totally makes
Yeah.
sense. Like people ask me, like, like at work, we kind of joke around during the day. Everyone kind of has their own thing. And like if someone didn't hear the joke and someone's like, oh, Serv, hey, tell them what you said about,
Oh,
I'm like,
yeah.
yeah,
I
I
know.
can't. It's not the same. It's not the same.
Guess you had to be there.
I know, I know. There's a lot of inside jokes at work and things. And if you're not part of that original like inside part, then it's hard to explain sometimes. Unless
Sure.
you're really good
Yeah.
at explaining things.
No, it's so hard to. I mean, if you're writing a joke for stand up, you have to build the scene. It has to be like framed. Whereas obviously, when you tell a joke in the oral surgery bin, it's just like just off the cuff. Everything is recreated because the situation's already there. Yeah.
Yeah. No, that makes sense. How do you like when you're like walking around, like do you just think of something, and go, oh, that would be cool, and you like write it down somewhere, like on your phone? Like how does that creative flow work for you when you're thinking of content?
Yeah. When I was just doing stand up, I'd always just keep a stand up notepad, and you're always
Like a
looking at
real like
something.
pen and paper, or do you have like a
Yeah.
digital,
And I still keep a notepad. I don't know because I'm
just
I'm
like
older.
Eminem, just the spiral? You got the spiral
Yeah.
book.
Mom spaghetti. So I
Yeah.
keep mine, and I still have it. I still use one every time I do open mics. I just can write faster if I do that. And then whenever I have a show, then I'll always like put the jokes down that I'm going to do, the set that I'm going to do, and it's on paper. And I never look at it, but the fact that I wrote it down, it puts
Right,
it to
right.
memory. But then, like more TikTok and Instagram videos, my mind is just looking for things in dentistry that we do that we never talk about, but I know everybody does. And then if you do a video, people are like, "Oh yeah, we do that in our office." So yeah, it's a little bit different. When you do stand up, I'm trying not to, if I'm doing stand up for a show that's not dentistry, then I won't do any dentistry jokes
Got it.
because otherwise you're like a one trick pony, like, oh, he's the dental comedian. But if I do a
True.
dental show, then obviously it's going to be mostly dental jokes.
So you have a whole
Yeah.
like separate content list for regular shows.
Yeah, if you're like, if we have a comedy club in Eugene, Olson Run, and they get some, you know, I don't know, Anthony Jeselnik, Kevin Nealon, some bigger names, Adam Ray, Seattle
Yeah,
guy.
yeah, yeah.
I remember doing a dental joke once, and someone talked to the owner afterwards, like, I didn't realize I was paying to go see a dentist do jokes. So it like kind of framed it as like, hey, can I give me 5 minutes? So I just stay away from it.
All All right. Well, if that works, I mean, if you found that's a thing, then that makes sense. Your name's Bert. Your first name, Bert. Is that like short for anything, or is it just Bert?
I'll let it out there
Bartholomew?
right now. My name's not really Bert. That's my stage name.
Got it. Got it.
Yeah.
So if you're Googling Dr. Bert Walpack, then
Yeah,
it's
I have
something else.
no Google reviews or anything.
Got
But
it.
yeah, Bert
Got it.
was my dad's name, and I was supposed to be he was the third Bert, and I was supposed to be the fourth Bert, but my mom hated the name, so we
Yeah.
changed it. And then Walpack is just the
Yeah.
name of my favorite town in New Jersey.
Because I was wondering, like, because I'm Indian, and when you're growing up, like Indian people have nicknames for their kids.
Mm.
Like Scott isn't really Scott; it's probably like Sukhminder Singh or something, and like
Oh,
Raj
okay.
is like Rajesh. It's just one of those things.
Roger.
It's not, it's never a Roger. There's
No.
no Indian Rogers out there. I'm pretty sure about that. Like real Rogers. It's like
And then
Rajinder
you
or Rajesh or something like that.
okay. And you didn't decide to do that?
Oh, I mean, the Serv is, yeah, it's Sir Wahan. And honestly, even for an Indian name, Wahan is not very common. Like I don't,
Okay.
I think they screwed it up down the line in some paperwork, and it just got screwed up. So I don't know what happened, but it's not even very common in India. So oh well,
Oh.
it works. Like if you Google me, like there's only one of me in the world, so it's easy
Oh,
to find.
that's perfect.
It's good and bad. It's good and bad. But yeah, thanks for coming on. And how did you even get into dental school then? If you're all like comedy, that kind of.
I was living in New York City and I was an engineer. I was an engineer in the day and doing comedy at night. And then I kind of took a step back from stand up. I had this awful show. I was already kind of out of it, but I remember having a show out in the Long Island and at the Talk Box, and it just wasn't going well. So then I went to crowd work and it just like stopped. And I remember I took a break after that. And then I was like, I don't ever want to do that again. So I was pretty shakeable.
Yeah.
And then I'm a big runner. I used to run in college. So I started running again in Central Park with my friends, and they were all like either finance guys or they were going back to school to become ER docs. One was becoming an ophthalmologist, one was becoming an optometrist. And I was like, oh, maybe I should do something in health. And then I took a test at NYU, like a career test to find out if I like what my true passion was, because I was all over the place. And it said dentist, then audiologist, and veterinarian. So I just went
Interesting.
with yeah, I just went with it.
That's interesting that people do that because I was like dentist from the fourth grade. I'm like, I'm going to be a dentist, and then some people are like, dentistry sounds cool. At the end, like, and then they get in. I'm like, that's great that you did that and it worked out.
Why dentistry when you were a 9-year-old?
Well, yeah, my mom was a nurse, and like back then, she had a lot of friends that were dentists and they were doing well. She's like, you should be a dentist. And there's like, other than her, there's no medical background in my family, and so I'm like, all right, I'll be a dentist. It sounds cool. So I was always dental, and I didn't even know what the specialties were when I got into dental school. I had no idea. I was like dentist, man. But when I got in, I went to Tufts, and when I got in, you're doing wax ups and all these things, and I'm like, yeah, it's okay. It wasn't like the best thing ever. But I'm like, yeah, I'd be a dentist. But then, they make you go through some of those rotations. And I did the oral surgery rotation my second year. I'm like, oh, this is what I want. And so from then I'm like, I'm going to do whatever I need to do to get into oral surgery. That's kind of what I did. But
Oh,
that was just
smart.
kind of my track. I had no idea what perio was. Like when I got in, I had no idea.
Yeah,
So
I didn't know either. My
yeah.
grandfather's a dentist, but my dad was a teacher, and my grandfather did really well as a dentist. And I remember like thinking in like college I should go into dentistry, but I was already like 2 years into engineering, and I was like, I'm not going to switch. And then yeah, I got to make the decision to change. I went to dental school when I was 29,
Okay. Yeah.
and so I was just kind of late to it. But yeah, like you, I didn't know what a root canal was. I didn't know what a crown was. Like the first day of dental school, I didn't really know like how to make a crown or any of that kind of stuff. And
No, no.
I will say oral surgery, everyone's favorite rotation. It's just like completely outside of everything we learned in dental school. Yeah. And that's not even oral surgery. Like you don't do any of that stuff anymore, I assume. You're not like degloving someone's face to do a eggshell fracture on their forehead, right? But you did in residency.
Yeah, so I saw your recent post on that, like the dental anesthesiologist. That was pretty funny. Like,
Oh
how
yeah,
do
yeah.
people kind of choose what they want to do? And you're pretty spot on with a lot of those things. Like, if you guys haven't seen that one, he just put out a post. This one was pretty recent, I think, a few days
Yeah, it
ago
was like
or
Wednesday.
within a week ago. Yeah, yeah. And you kind of went through all the dental specialties and how people kind of are with those. I think that was pretty hilarious. Yeah, you're right. In residency, what you said about oral surgery, like we do some crazy stuff in residency. And most surgeons, when they get out, they don't do all the crazy stuff. Some definitely do. Some super specialized. Some do whatever. I mean, I know some oral surgeons that got out of oral surgery training and then did a fellowship in breast implants, and that's all they do. Like that's crazy, right? But
Yeah.
that's the thing. I just do the exams. I don't do the procedures. But I'm just kidding. I don't do that.
I got you.
Yeah. But yeah, so that's the thing. Like, so, but we still take trauma calls. So, like, our practice in like north of Seattle, we have 5 surgeons we have 5 partner surgeons in 4 locations. All of us still take a week of trauma call at the hospital. It's not so much bicoronal flaps and things as much because that still gets probably turfed to Harborview, which is the only level 1 trauma center. But we still do a fair amount of trauma and things just from that, and obviously head and neck infections, things like that get admitted. So we still do some of that, but it's kind of like what you want to do. Like if that's what you want to do, you have access to it. That's great. But a lot of
Yeah.
people at some point they're like, I don't want to get called at night. I'm done with that, and it makes sense too. So
I did like an AGD, like a GPR residency in New Mexico at University of New Mexico, and UNM doesn't have like oral surgery for the ER. They use the ENTs.
okay,
So like ENTs will like take out some teeth, or at
yeah.
least do some sinus, put
I mean,
a
that's good for the ENT
IND.
training. Like it gets more coverage for them. I think that's great. In my residency at the time, they didn't have ENT residents, so we covered ENT also. And so that was for us, that was actually good, except for the worst thing, honestly, the cover in the hospital when you're on call at night is the nosebleed. I can do a full face lac at night or ear or something, but a nosebleed. So it's like literally you'll get a text, like all the residents probably, that cover this stuff, unless ENT's covering it. They'll call you like, hey, I got a patient in the ICU, he's got a nosebleed. I'm like, all right, pack it. Like they already did all that before they call you, right? They're like, we already did that. Like, oh yeah, just, pack it one more time, put a little epi in there and some local. Oh yeah, we did that. I'm like, all right, fine, I'll come over. And then you come over and you do all the packing. Sometimes you put a Foley catheter in there. You do all these crazy things. It's always a patient on some blood thinner, right? And then like 45 minutes later, you're in the call room trying to go to sleep again, and he's bleeding again. And then like you have to go back there. The whole night could be that with just the one patient. But then you have all this other stuff you got to manage. So nosebleeds are always the
How
worst.
bad is a nose? Like, what if you just let it bleed?
It's a lot of blood. It can be a lot of blood, and
Is
then
it okay?
it's just it's all over their face, and the nurses have to change the bedding, and like they don't want to have to do all that all the time. They got
I
so
think
it's like
your nosebleed. You've seen nosebleeds I have not seen then.
yeah, yeah. No, they're significant. It's huge liver clots like in the mouth at that point too. Like it's a lot.
Oh yeah.
So those like that and earwax. Like yeah, that's why I couldn't do ENT. It's all the earwax. But anything else, I'm good. I'm good.
I remember the oral surgery rotation in dental school. It would always be the residents would say, "You like oral surgery? You're pretty good. You should do it. You should apply." And you're like, "What about the whole fact that I have like a 3.1 right now? You should check that before you ask me if I should do this."
No, if I
But
liked orthodontics or endo, I would have done that. But you know, I didn't like it. So.
okay,
So what do you do
yeah.
in your practice? You're a general dentist, right? But do you do extractions? Do you do root canals? Like, what's your scope? What do you like to do?
My favorite. I love doing extract and bone graft with like a PTF membrane. Those are my happy days. It's just like, especially have like an abscess tooth, and then I just bought like a curette maybe 2 years ago that has like a little more grip to
Spikes?
it. Yeah, and that made it even more fun.
Yeah.
And then I love stitching. I do a lot of soft tissue grafts, and I think mostly just autographs.
Nice.
Yeah, I like doing that. I still really like doing class twos, like fillings, but endo, I won't do any molars anymore. I used to do sedation, like IV sedation right out
Oh
of
wow.
you and yeah, and then I don't know, it just brought some weird people into the practice and was much more stressful. Like, you take a tooth out and then you're like, okay, I'll send you home. You have a driver, and then the driver comes and they're like, I can watch her for like 10 minutes. I'm the social worker. I'm not expected to be here for 4 hours
Oh yeah.
uh, or one person try to walk away afterwards. And I was like, I'm like, how much am I supposed to restrain somebody from wanting to leave?
Yeah.
I was
There's a
an
lot of
associate,
protocols with that. Yeah.
but if you're an associate too, you don't have much control. If you're like, hey,
No,
senior doc, do you mind hiring like a nurse that can like hang out with these people afterwards? Like, no, we don't do that. Sharon's pretty good at that. You're like, okay.
that's nice. Go
But
Sharon. Go
I
Sharon.
think I would have liked IV sedation more if I did it like after practicing for 10 years. Like I remember doing like a crown prep and IV sedation. I mean, I don't think you blow in as much water as I blow in doing an IV sedation
Mm-hmm.
with a crown prep. And
No.
if I could have like felt really comfortable doing crowns and endo and be like, okay, now I'll add IV sedation to my, yeah, to my work.
Yeah,
Also, there's some
oh,
weird
go ahead.
stuff with IV sedation where they're like, "Hey, we don't have propofol all the time. When there's not enough propofol in the country, so order something else." I mean, do you ever have a problem? Is there like
Oh yeah.
sedation drugs that just aren't available?
Yeah, they're like all of a sudden, there's going to be a propofol shortage or a ketamine shortage, and you're like, all right, well, like I don't know what else to do if I don't have this medication. I mean, we have
Yeah.
some options, more so, I would say, but it's propofol's a big one. That's like the main thing for the sedation for us. I just went to this morning, actually, I just went to a malpractice seminar. Like our malpractice insurance puts on these 3 4 hour CE courses and they talk about closed cases and things. And they even mentioned it today, like the closed cases on IV sedation that people end up suing over. A lot
Hmm.
of these patients, and I'm not talking about the death cases or anything like that. What I'm talking about is, maybe an adverse event or something like that. These patients, a lot of times, don't have a lot of drugs in their system. Like there's one patient, like they were saying, like this practitioner got a lawsuit in like 75 minutes. They had like 5 milligrams of midazolam, which isn't a
God.
lot. Like we
No.
give that for like 20-minute cases a lot of times, and like 25 micrograms of fentanyl or something. And that's like a starter dose for like, hey, we're just gonna give you a little bit just to relax you before we give you the real stuff. But sometimes that's enough. I mean, so you have to be prepared for those situations if they have a breathing issue. And so that's the thing. It's not oftentimes just snowing somebody and having a complication. You can still get it. I had one patient on oral sedation. I did a halcyon case, and if you've ever used halcyon or triazolam or
Yeah, I
something,
use that.
yeah, 0.25 milligrams is like a normal dose. Since that case, though, I changed my dosing of Halcyon. So now I prescribe 0.125, so half that, but I give them 3 of those. And so I have them take maybe 2 in the office, which ends up being a 0.25 dose, right? Depending
Yeah.
on the age of the patient, you got to take into a lot of factors. And then if they're still needle more, I give another 0.125 because there are some patients, even just on the 0.25, that's just too much for them. And so like I've had that happen too. And so like now I divide it up. And so like I just do a 0.125, and it's just easier to micro titrate it, even for me. And I do IVs every
Yeah.
day, and so that's interesting.
The thing that I always thought was stressful too with IV sedation is when they're like, "Hey, I'm not sedated enough. Can I get some more?" And the same thing happens with oral sedation. You're like, "Well, I know this person's not going to remember this afterwards, so I need to like say no to this person because I know they're going to forget we had this conversation in about 3 seconds." I remember taking like an oral sedation class through docs, and what the guys would do is they would uh, crush up like a certs and put it with the halcyon and put it under their tongue, and so that when like 15 minutes later, like, "I'm not feeling it. Can you get some more?" You just give them the certs instead, so they
Like
feel
the
like,
placebo, the
yeah.
placebo. It's like almost like, you ever go to Disneyland and what's that ride? The Haunted Mansion ride?
Hmm.
Have you ever been in that one? Disneyland. So you go in this one room first, everyone gets crowded in this room, and then they close the doors, and it looks like it's an elevator, like all the pictures start moving up, like it's like a pretend elevator, right? But
Right.
they make it feel like you're in an elevator, like going down or something.
Hmm.
That's what sometimes I joke around. Hey, we don't have any meds in your system. We're just moving the pictures around, just to make you think you're sedated.
Yeah.
But yeah, that's generally how I tell them. Sometimes the pictures are going to move a little bit. It's going to look like that for a little bit.
Why would you do oral sedation and IV sedation for a patient?
So oral sedation, I don't use it that often. Like kids, like pediatric cases, adults, I do oral sedation with nitrous
Hmm.
generally. And so like if they don't want to be completely out, they just want something more than just nitrous alone. And so I would use halcyon. I use halcyon and nitrous. Sometimes I do oral Versed and nitrous.
Okay.
It just depends, but it's not that often. But definitely people still like the halcyon, and that's an option people do. And so
Hmm.
I generally just couple that with nitrous if they want it.
Okay. Yeah. The last thing I didn't like about IV sedation was placing the IV on people. Like, I love doing AC, but sometimes people are like, "Hey, I'm a pretty hard needle stick." Even a phlebotomist couldn't find it, so she used like, this one in my head. And I'm
The
like, "Oh
the
God, I
butterfly, yeah.
I never do this. I do this once a month. You need to give me the easiest one, and
Yeah, I know.
that was stressful because you'd have like a 3 hour appointment and they're dehydrated because they didn't eat anything or
Yeah. It's hard to find a vein sometimes. Even for
yeah.
us, like, we do it every day and it happens for sure. We have warm packs, we have those things, whatever, but still sometimes it's difficult.
Or
I've
the
even had to put them
sometimes,
in the top of the foot before in some people because they just couldn't find anything else.
so I had that once, I put it in their foot and I just felt bad about it because I was like, this is outside my scope of work. And she
Hmm.
just, I could never get her sedated. I don't know how much I gave her, but it was like, I gave her probably like after giving her 10 milligrams of Versed, she wasn't feeling anything. And I like kept looking at the line to make sure there wasn't like some bolus that hadn't made through and I'm about to hurt her.
Yeah.
it was like really stressful, especially doing IV sedation early on in my career. I think I was stressed enough just with everything else and with dentistry that I
Yeah, I mean, even
didn't
like
get
you're
it
in
done.
Oregon, I'm in Washington, and
Mm,
obviously marijuana is legal, and that does affect sedation.
mm.
Red hair traits, the MC1R gene is a thing. I actually did a podcast with an anesthesiologist talking about that gene trait where people metabolize local anesthetics and general anesthetics differently because of it. So that's definitely a thing too. That's like a known thing. But what's the craziest thing like a patient's ever said to you? Like, do you have like patients
Uh,
sometimes that just say some rando stuff to you, or they know
I
that you do comedy or something?
people that know I do comedy are usually cool to begin with. Like
Yeah.
they either know me on like TikTok, Instagram, they're my patient. So I think they're already cool if they're looking for comedy on that. And if I see them at a show, they're like, "Oh my God, that's my dentist," then they're cool enough. But
Yeah.
when I worked in Reedsport, Oregon, which is like the coast, I ever had some guy like he was an old guy and he brought like 3 bullets in and he's like, "If this hurts at all, I'm putting one in your head." I was
Whoa.
like, "Okay."
Was he
And
like
then like
open carrying, like Tiger King or something? Just comes in.
no, he just brought bullets. I don't think he had a
Oh,
gun
just
either.
bullets. I'm gonna
Yeah,
throw
I
these
mean,
at you.
I thought he had a gun, but then my assistant's like, "Oh, that's Gerald. He does that with everyone. Take it with a grain of salt." And I'm like, "Okay, well,
He's like, thanks, Sharon.
thank
All
you,
right.
Sharon." And then another one, I remember I was working in I worked some rural places, Canyonville, Oregon. Someone came in for a tooth need extracted. It was like class 3 mobility. And I was like, why hasn't this been extracted before? She's like 22. And then like while I'm getting her numb, she's like, I'm gonna get some like Percocet for this right afterwards. And I was like, well, let's see how it comes out. I might just feel bad. And she's like, mother, to me. And then like went out to the waiting room. This guy's a quack. I have 3 other dentists that are gonna get me Percocet, and this one won't. And I was like,
Yeah.
why did she go to him? But I
I
don't
know.
know.
I know.
Serv, you might like you don't have the dialogue when you start practicing for handling that situation. Whereas now I could do it, but then
Yeah.
I was like shaking for a while after I got yelled at for not prescribing something I was probably not going to prescribe.
I mean, the best thing that happened for patients and for practitioners is they've really locked down on narcotic prescribing. And now I think now patients are more informed like that, over 5 narcotic pills is a lot these days for kind of what we do, I think. And so like I think it's nicer for us because we don't have to argue as much with patients. Like I remember when I first started, like the routine, like people were doing like 30 Percocets for wisdom teeth. Like that was like a
Okay.
thing, right? But that's no longer the case, obviously. I mean, it's definitely good for addiction and those sorts of things, I think, over time. But at least now patients are better informed.
Yeah.
So you don't have many of those arguments like that as much. So the reason I found you online is I had Brady Smith on the podcast like
Oh yeah.
earlier in the year, and I know you guys did a tour together. So how'd you guys like hook up and do? I'm not hook up, but like how'd you
No, no.
guys
Say it.
connect? And who's taller, you or him?
I think he's taller with his hair is taller. We're pretty close.
Yeah, but he takes it off, so then he's the same.
Yeah, I think he's taller. I did a show maybe like 5 years ago. Maybe it was 2018. I did a show a long time ago, and Andrew Rivers from Seattle, I opened for him, and then he knows Brady. He's like, hey, there's another comedian. I don't think Brady was doing any stand up then.
Yeah.
So then Brady had me on his podcast like 8 years ago, and uh, we were going to do a podcast together. Maybe he talked about, but I was like, I can't come all the way up here to do a podcast, a 2 hour drive. And
Yeah.
then I never heard from him again. And then maybe I posted stand up clips when he was getting really big. And he's like, sorry, one thing about Brady is he's very ambitious, and he'll say so himself. He's almost delusional as to what he's like, hey, how about we like quit our jobs and just do this full time? And like that was kind of the phone call. Like, you'll be my opener and we'll go across the country. I had no idea about social media like 3 years ago, as far as like I wasn't going to rely on it all. I didn't have an Instagram or TikTok. And
Yeah,
I
I
was
was
like,
looking at
sure.
yours. Like it's pretty recent, like your stuff.
Yeah, I don't know. I was like kind of a boomer, a Luddite. I was like, I'll just, if you want to make it in stand up, you network, you make
Right.
friends with bigger comics, you make friends with the booker. And I was still kind of like thinking about that. Just, I'll send my tape into this comedy club and see if they get it. But then Brady's like, yeah, we could do a tour. I was like, Brady, sorry, do people know you? And he's like, I have 500,000 followers on whatever TikTok. And I was like,
Yeah, yeah.
oh. And then I was like, you idiot, Bert, you should have been doing that the whole
Mm-hmm.
time. Why was I only concentrating on open mics and stand up? So then
Right.
after I talked to him, I started posting like every day. And
Yeah.
you got to do it every day. I don't know, Serv, if you do it every day, but you're a slave to it a little bit. I
Mm-hmm.
get kind of like an anxiety around like 10 o'clock in the morning if I haven't posted yet. And then once I post, I'm like, oh, okay, I don't have to worry about that. I'm done. But a slave to the algorithm. I love stand up. That's my favorite. I wish I could just do stand up, but the videos that I do on TikTok, as far as like, acting like an endodontist or an assistant, get me much more views than posting my stand up. And I think a big thing with Instagram or any kind of social media is it's really based on eye contact. If you have eye contact in your phone, then people are generally, like, naturally, because of evolution, they're going to look at you. But if it's a stand up clip where it's you on stage making eye contact with the audience, not with the camera, then people feel more apt to just, swipe out. Next,
Yeah,
next.
you're right. It's kind of like the moon following you. Like it's like a psychological. Makes
Yeah.
sense. Makes sense. So why do dentists make good comedians in your case? Or probably not all of dentists, obviously, but like the mind, is there
Yeah.
something there? Like, because like you guys come up with content that's like everyday stuff that happens to like a lot of us, but you frame it in a way that's freaking hilarious.
I think like we have the time. I mean, there's funny anesthesiologists. We have an ER doc that does stand up in Eugene and really funny, but he just doesn't have the time. It's that. And here's the thing. I have a staff of 10 people and I pay them twice a month. And I know they laugh at stuff they shouldn't laugh at because they're just trying to please me. And I like to think I'm apt enough to know, like, that really wasn't funny, Bert. That was just them thanking me for their bonus,
Right.
their paycheck.
Courtesy laughs. Yeah.
But I think it does make a lot of dentists be like, hey, pretty good. I
Yeah, you
should
got your
go.
audience that's gonna laugh because you're paying them, and then for their
Yeah.
work.
So I
So
think
you
that's
have
a
a
there's a
little
while, like,
confidence.
exactly. It's why a lot of us do it. I think is because we're like, I'm pretty dang funny with my audience.
Yeah.
Yeah, and we just got our time on our hands. I mean, how many times I don't know if you've noticed it, but whenever I go visit a clinic, usually the doctor's doing something, watching some video that has nothing to do with dentistry back there, whether they're into fishing
Right.
or rock climbing. And there's just like so
Golf
much
or something.
downtime.
Yeah. Yeah, because I do a lot of my content creation. When I say content, like editing videos and things like that, between cases, like or between patients, sometimes I go back there, write my note. I have like, maybe 5 more minutes, 10 more minutes, and then I go, yeah, I can just work on this real quick. It's nonstop. Like I
Are you
agree, it's
embarrassed
it's a
when you
lot.
do it, or are you like don't want
So I
leave
don't
me?
do the talking into videos. I'm not comfortable with that just yet, like you guys
Yeah,
are. So like a lot of my stuff would be editing videos that I've had the camera on recording. Like so, it's not me in the video, but it's the procedure I'm doing in the video. So most of my videos are like that. All the podcast stuff is all pre-recorded, and I'm just editing like this kind of stuff into shorts, and so that's easy. But I'm
I
not
guess I
like
mean,
talking freely into the camera like you guys do.
but are you embarrassed if your staff finds that
Yeah,
he's editing a video right now?
oh yeah, sometimes I take
Yeah.
like like pictures or something, and they'll come and go, "Oh, well, sorry." I'm like, "No, it's just for social media. It's just that gets a little. I'm still not used to that part of it, but
Yeah.
that's fine. I don't
How
know.
long did it
You
take you to figure out the filter for your extraction videos to not show blood and like what TikTok would be okay with?
on TikTok? Not very long because you start showing surgery on TikTok and Instagram too. They'll just black it out, right? If you
Yeah.
see like people's surgery pages on TikTok, but then it's not even a blackout. I feel like they suppress your stuff too. Like
Yeah, I
it's
think
a
you're right.
shadow ban type thing, right? Like they block it so it's not promoted on their algorithm, but also I think oh, this guy's we're gonna give him negative views, and like, whatever they can do, I'm sure they do it. Same thing with Instagram. I didn't start Instagram until after COVID, like the pandemic, like in 2020 something. And so like people that were on Instagram before then doing surgery stuff got really big because the algorithm supported that back then.
Yeah,
It
you're right.
started cracking down kind of before that, and people just kind of plateaued with their followings with surgery stuff. But when I got on, it was on the decline for that for sure. And now it's just like I'm continually suppressed. Like my main account, like it shows all my surgery videos on Instagram. Even if you like type it in, like Instagram doesn't really bring it up there. Like it's like even it's ridiculous. So that's kind of why I started the podcast, because the podcast is like PG 13,
Yeah.
PG. I don't show blood or anything on it. And so like it has a wider reach, and we can go more in depth into topics too, which is also cool. So that was the main reason why I started that like 2 years ago, to add to that. But the surgery stuff I do is different than the podcast stuff I do. It's like two
Right.
separate things. But I do everything myself. I don't have a, like a helper or anything. So
Your
it's a
surgery
lot.
videos are like, they're so satisfying. I
Thanks. But the
it's
TikTok
I'm
stuff, yeah, it's like I took like the blood colors out the videos, is basically what you were talking about.
Yeah.
And so that gets by their algorithm.
So do you have fans that aren't in dentistry? Like there must be people
I
who
don't
just
know. I
no,
don't
they
think
don't.
so. I think
No.
probably, but honestly, I think my audience is so focused into dentists and surgically minded dentists. There might be some, dental assistants and hygienists or something, obviously too, but it's a lot of global dentists mostly. It's really highly focused. I don't
It's
know.
so cool. I agree. It's the one thing I found about social media is that, oh, this guy follows me from like Indonesia, and I just like, what? How come? And then you get some. I'm sure you get some strange requests like, oh, I'd love to work for you.
Yeah, can I
Help.
shadow you? Can I do this? Yeah, a lot of that. I get it every
I
week.
need
Yeah.
help with my visa though. Can you help me with my
Oh,
visa
there's
to get
some
in?
of the, I mean, too many. Like they'll get all these like, what do you think about this case? And they'll send like 5 photos and a video. I'm like, I can't do all that. It's just, I'm not, I just, that's a lot of free advice, and not even that. It's just, I'm not going to give you medical advice. Just looking at your random bad pictures that you sending me, just little screenshots. It's not even the whole CT scan. It's just I can't.
But
But I get a lot of
the
that.
the thing I like about your videos is the same. Like, I like watching like people draining abscesses or like a horse getting its like getting a farrier's like putting a horseshoe on, cutting its
Yeah,
excess, or a cow that has like a nail stuck. They remove the part of the hoof, and I mean,
yeah,
and I'm not a farrier, but it's the same kind of satisfying when the tooth finally pops out. You're like, oh, thank God he did it.
I know.
Um, I was just hoping it would be more people than just dentistry because I think it's just such a satisfying reaction.
Yeah, I
Like,
know. Not yet, but maybe at some point it'll break through. But
yeah.
I don't know.
In residency, we did some extractions with Robert Urquhart. He's a dentist in Albuquerque. Patient would be sedated by the dental anesthesiologist, and he would just show you like, okay, make your cut here, and then you're gonna, you're gonna use the striker. It's gonna be you're gonna use it like a paintbrush, all right, paint
Yeah,
around.
yeah,
But the first time we used the Selden and just like retracted the buccal gingiva and just seeing the bone was like I've never it's so white. That's what like almost threw me back. Um, yeah, you just don't expect something to be that white in someone's body.
unless you've had like minocycline, then it can look yellow, which
Oh,
is
really?
crazy. Yeah, yeah. The teeth get, the wisdom teeth roots are like blackish gray, but the bone is also like a yellow tinge with that too. It's crazy.
Hmm.
Yeah. What do you think, like, as far as like new dentists coming out, like what do you think is like the biggest mistakes they make that may, cost them money? Any thoughts on anything like that?
It does seem like you have this huge load of debt. I don't know what it is. Mine was 300,000. I'm sure it's like 600,000, and then you're like,
Yeah, yeah,
you know,
you're not lying. You're not lying.
I mean, I did upper molars in dental school for endo, found MB2, and you're like, all right, well, I'll just do this. I did that, and you might, well, I've gotten to see some implant cases. I've seen them on YouTube, so I'll just do it. And I think I did this too. I would do like some endo that I wasn't really should be doing early on because I had to pay that $3,000 school payment, which I
Mm-hmm.
imagine is more like $5,000 or $6,000. So
Right.
I don't know. I guess just take the class. You got to take classes, make sure you're really comfortable about it. And when I graduated, I still forgot that there wasn't someone I could go like, hey, I need some help. Could you just find MB? If you just find MB2 and put a
I can
file
do
in
the
it, then I
rest.
can
I can
take.
do the
Yeah,
rest.
just start. Yeah,
Too funny.
yeah. And I don't know. I also put money into your retirement. I'd
Yeah.
say make your minimum payment on your student loan. I wish I did that. I got like so addicted to just seeing that number go down that I don't think I was even doing any like a 401k. I was just like, I just want to pay off my student. And I was like
Right,
34.
right.
I should have been like, just max out my Roth, max out your 401k, and whatever gets left over goes to student loans. And then now I have like two business loans. My student loans are 300,000. Each of the business loans were 600,000, so
Right.
1.2 million dollars. And for some reason, psychologically, it doesn't bother me, and I just pay the minimum on those business loans. But student loans are so caustic, and you just want to get that monkey off your back because it feels like the money is not going
But
anywhere.
the interest should be better on the student loans, I would think. But I don't know.
Uh, yeah, they were like mine were like 7%, and then
Yeah.
I got my business loans before like during COVID, so it was like 3%.
Oh
But
wow.
I don't know what it is now.
Yeah, it's not
Yeah,
bad.
and now that I look back, or when I look at like interest rates over the last 40 years, I was like, oh, that was the lowest it ever was.
Is your private practice your own, or are you like a corporate practitioner still, or not?
Uh, no, it's my own. I bought one practice in 2017 from a retiring doc, and it was 980 square feet. So it was just three ops, and one op had the hygienist in it, and I'd work out of two ops. But if she was like sick for like a week, it just like killed production. So I kept trying to
Yeah.
move into a bigger building, and then I was like, well, I'll build a building because you gotta, if you own the building, you just like live like kings forever. So I was like, I don't know. We're not Seattle, obviously, but we have very few, we don't have much real estate here. There's like an urban growth boundary, so there's just not much land to buy. And I was looking at buying, like building my own building, and it was getting astronomically expensive. And instead, right after COVID, my accountant introduced me to a doctor that was like, "Get me the hell out of here!" And she had a really nice building, and so I purchased her practice and just moved my patients from the 980 square foot to the 4,000 square foot practice. There's a
So when you
plastic surgeon across the hallway from us. I never get any patients from him, but we get patients from like the ENT, the oral surgeon, and then we also have like an eye doctor. So there's like so much traffic, and people just come in. They're like, "I'm trying to find where my ENT appointment is, and are you guys taking new patients?" So it's like it's great. Whereas the other
that's
place, we
nice,
were just like on
hidden
the
away.
river.
Yeah.
Yeah, the Oregon
But
Duck football team would always come in because they were rafting the river and like, "Can we use your bathrooms?" And I always said yes because I support our ducks.
yeah, yeah. Is that where Oregon is? Like the U of O in Eugene, right?
Yeah, it's in Eugene,
Okay, that's right. Okay,
and I'm
nice.
on the outside looking in. I didn't graduate from U of O. I'm not bleeding duck, but they're around.
Do
They're
you
always around.
guys do working interviews then for like when you're hiring people?
No, I guess I've never done a working interview. It's always like I do a vouch. If it seems like whoever I hire, like I'll put something on, Indeed, and then I'll get like 50 responses, and then I get back now only 10 are interested after waiting
Right.
2 days, and then I'll have like two people interview, and it's like it's pretty rough, and then I'll see if they want to do a working interview, and then last minute the office manager says, so and so from so and so's office says she'd like to work here and we love her. And so then I just hire that. I just really want to hire people that someone can vouch for.
That makes sense. I mean, people
Yeah.
like on those things we do working interviews. It's weird. Like you're right. There's attrition. Like there's so many people apply. Only half of those or less want to come in and actually do a working interview. Some just like ghost you. They're like, it's just like ghosting is a thing, right? It's like, wow,
Yeah.
this is like a job interview, but whatever.
I
It
know. And I'm
happens.
not like, I don't know. Maybe you and I are about this. I'm 46. I hear people like complaining about other generations. Like, oh, Gen Z is not ready to work or but like, I don't, I don't see that necessarily. I just think we just always complain about new generations. I don't know. It's gotten better. Like the last time I had to have a job opening for people, it was like 100 people applied, and it wasn't just people that needed it uh, for their unemployment. It was like I really need a job, and it's hard to find a job right now, at least in our
Yeah.
area. And sometimes you get people who like, I did some dentistry. I worked at a dental lab, and but then they come in, you're like, oh, well, you never talked to anybody at that dental lab, did you? You're like you hate making eye contact, but it's anybody who worked for like
Sometimes,
eye care. Yeah, go ahead.
sometimes you just need a warm body and like you need somebody to start, do something. I know you do comedy. Like it's for me, what I do is like a creative outlet. I feel like what's nice is I've able to monetize some of it now, which is great. But obviously, oral surgery is my main thing. But like, what do you feel like is the reason most dentists or a lot of dentists go through burnout? With their profession.
I think we're like just one, we're way too hard on ourselves. So like remember seeing like a class two filling and what's supposed to look bench top and getting your grade and just getting like murdered on the grade, like, oh, it doesn't really click floss, it kind of snaps floss, or you're like, oh my God. So I think you can't do things perfectly. And I think if you're just trying to do it perfect in an imperfect world with tons of saliva and a tongue bothering it, like be nice to yourself, be easy on yourself. And I I I think you just need another outlet. Like dentistry can't be everything, and sometimes dentistry really is. If you go to like you must know oral surgeons who are retired and or like, this guy's practicing at 80. It's like it's the only thing he likes doing. And but I just think you need something else because in stand up, I'm always more stressed about the open mic that's that night and about doing well than I am if I messed up a crown that I drilled through because I was getting the occlusion died in. That would just like kill me for like weeks. But then once I started adding the hobby, then the hobby got to me more important to me.
That makes
Yeah.
sense a lot because I don't generally get nervous at work. But these sorts of things sometimes, like it's like the highs are really high sometimes. Like let's say you have a post that pops. It's like it's almost I don't gamble, but I feel like that maybe that's the feeling that people that gamble a lot have like when they hit it big on something, right?
Yeah. One analogy I heard about like posts that popped that helped me is like let's say you had this like 12-week class in pottery and then one teacher says, all right, Serv, you're gonna work on this one pot for 12 weeks and it has to be just make it as perfect as you can. And versus another teacher is like, hey guys, we're gonna make a pot every single class. And then once you made it, you're done. Then you have to work on another one the next day. And then that's what social media is like. You'll have really good reels because you didn't even think anything about it. You're like, oh, I got a funny idea, and I'll just record it. But then there's these babies I have, these thoughts in my mind. And I'm like, oh, that'd be such a good post. And I'll work on it. It's like 12 costume changes. And I'm like, do the dialogue first. I'm working on the dialogue. And then I post it and like my manifesto's out. And it's like
It bombs.
100. Yeah.
It's like all the time. And the stuff that you don't think, it's like, oh, I did that one in like, 5 minutes. And like, that's the one that hits.
Yeah.
It's
Who's that?
funny how that happens.
Do you follow Dr. Erin Sheffield at all? She's an oral surgeon in Illinois, but she's like the only thing that ever works for me is when I do a dry socket post. It always just blows up, and people always have like want to tell their dry socket stories. So much so that the ENT she works with is like, hey, another dry socket post, huh? And she's like, yeah, my bread and butter.
Well, that's like my wisdom tooth videos then. It's like
Yeah.
just throw those out a million at a time. What you were talking about, like that people like criticize work and stuff, like there's definitely trolls online. And when I show like procedures and things, like I always not always, but people are like, oh, I could have done this. You didn't have to do that. I'm like, okay, slow down, buddy. First of
Hmm.
all, and then you go to their account, it's like some anonymous picture with not even their real name. It's a private. I'm like, you're not showing jack, dude. Like
Yeah.
you're just on here criticizing people with some anonymous account, and like you have no work of your own to show. And like that's just one of those things. I'm like block, block, block. Like get out of here. It's like I can't deal with this stuff. I'm not showing perfect stuff either. I don't want to. And like I'm not doing Instagram posts. I'm taking a tooth out. I'm sectioning this tooth, and it was an incomplete section. It was just a distal crown. I still got to go back. That happens all the time, even to oral surgeons, believe it or not. And so, like, how do I manage that? And so I get into that, and then how do I do that? Like, that's kind of like what I try to show.
Hmm.
You know,
Did the British oral surgeons extract teeth differently? I thought they're like, do they have a
so
different way to? Yeah.
they a lot of not a lot of them, but they're taught in a lot of places to do like lingual flaps. And so
Yeah, this is what I'm talking.
we're not taught that here in the States at all. Because clinically, I've even seen the lingual nerve like just behind a wisdom tooth over the bone, like going distal and lingual to it. Like I could see it, like it's out. So that is a thing anatomically, and like why even incise back there? I've seen some cases online, and this is not in the States, but people show like I'm using a cautery to make my incision, like it's so clean. I'm like, you're using cautery to do that incision, like right next to a potential nerve, like back there. Like it's just some of the stuff you see is crazy. But yeah, so that's why we're not taught that here generally. I mean, I have gone back there and like with the periosteal or curette and gently like, raised a flap here and there,
Uh-huh.
but I would never incise back there. It's all blunt, you know?
You must get comments a lot on your elevator, right?
Yeah.
When you're reflecting, because no one, you're the only person I know. Like, what is it called again?
I mean, it's like a Woodson elevator. There's another one
Woodson.
called Fontenesse, but yeah, I don't use a periosteal hardly at all, unless I'm doing a really
Okay.
big flap in the mouth. I just feel like for me, like I can get in there with that point, get under the periosteum quickly, and then once you're under the periosteum, You just take it, and it just reflects it easier. I can just control it better, and I don't feel like I'm macerating tissue like that blunt periosteal sometimes gets in there and just kind of crushes a little bit
Yeah.
because if you're not in the
Yeah.
right plane. And so like I just get that point where you need to, you're on bone, and then lift up, and then it pops up the periosteum. So everyone's different. Like my scalpel, the 15 blade, I don't use the flat handle. I use the round one because for me, like holding a round handle is more comfortable, like a pen, versus the flat one. Every time I get a flat one on my tray, it feels so weird to me now. Like I can't. I'm like, give me the round one, because I can turn it around teeth. I feel like a lot better, just like a pen, like you're writing or drawing. So little things like that. Everyone has their thing. I don't ever use a 150 or 151 forcep ever. I haven't used one in like 20 years, unless that's all they have in the tray. Like I teach at the University of Washington, that's all they have sometimes. I'm like, they slip for me. Like I put it on the tooth and it's like slipping off. I'm like, how do people even use these things? I use like a 962 forcep for pretty much upper and lower teeth. Let me see. I think I have it
Yeah.
here. This is a 962. So like I use it for upper teeth and
Uh-huh.
lower teeth, and it has like
Okay.
these serrated edges here, which grips it nicer. It's just ergonomically, I like it. I don't ever use 150 or 151. Everyone's
I thought I
different.
was going to hate doing extractions because in dental school we used like 88R and 88L,
Mm-hmm.
and like my hands like really started hurting after that and I was like, I don't think I'll do oral surgery. And then at the GPR residency, there's like, no, section it into a peace sign, and then that's what I usually do every time.
Yeah, sectioning is nice for molars. What's the biggest waste of money that dentists buy, do you think? Is there something you can think of in your practice that's complete waste of money when you bought
I'm pretty cheap.
it?
I don't think I'll ever buy a toy. I'll buy a cone beam,
Yeah.
and I like buying scanners. I love my Trio scanner. I always like an erglag laser. I think is sometimes a big waste unless you're just. I mean, if you have a hammer, everything's a nail, and you're like, all right, let's do tongue ties all the time.
Mm-hmm.
I don't know, but I'll probably get hate for that. But I think I use electrosurge for most cautery, but some of those lasers that are $30,000, it seems like a little bit too much for me. And
We bought during COVID,
yeah.
we were kind of forced in Washington State to just kind of do emergency cases for a few months, like during the heart of the pandemic.
Hmm.
And like we couldn't technically do elective cases. Obviously, a patient comes in with painful wisdom teeth, that we could still do that because they're symptomatic. But for general elective cases, they didn't want us doing it for a while. We had 4 locations in our practice. We bought like these. I don't know how much they were. They must have been like 8-9 thousand each. 4 of them because we have 4 offices. These huge machines with like this suction thing that you could like
Yeah. Oh yeah.
articulate around to clean up all your aerosols, and they were so loud. Like we would put it on, and we at the time we were also wearing like gas masks. Like we had full respirators, and then because when you're wearing a respirator, you're still breathing in and out. We put a mask over, like a dental mask, over the air intake and outtake of the respirators. Can you imagine doing procedures wearing full respirators? And then I had my loops, like they wouldn't fit right because the respirator, they were just up a little bit or just really tight just to get them down enough for it.
Yeah.
It was a mess. And then we had that fan thing going. Like it was a disaster.
It was a weird time. I don't like people became specialists on stuff and it didn't sound right. They're like, well, I'm just gonna have people rinse with like hydrogen peroxide first, and then that's like the standard of care right now with COVID. And I was like, what? Who decided that? Does that do anything? It's a respiratory disease.
Yeah. Right.
But yeah, everyone was a specialist with what they thought we should do for COVID. I mean, the salesman definitely said, hey, again, the oral surgeons bought the. They always do. I don't know if you know they do this, but if there's like an implant company or like my implant guys will be, yeah, Serv uses these implants. So, and you're like, okay, well, I don't know if
Yeah,
you
they
guys
do
know that
that.
they do that.
They do that. They like,
Yeah.
yeah, they'll like,
Yeah. What's
yeah,
an
name
elevator? This
drop. They'll
is
name drop. Yeah.
right. So I think, yeah, and then like there was a new endodontist in town that wanted to like get more referrals. So he gave all these masks out, and that was very nice of him. But there was weird masks. There was a mask that, because it was respiratory, it would start here and it had like, it would go up over your head, maybe like 18 inches, and it would just be clear, saying that the little bubbles wouldn't get in your face that way, but they could still like, they go up in the air and they would fall down underneath. But
Yeah.
there was no way around it. I still have three sterilized air filters. They were $2,000 each, and they're placebo. They I'm not sure what they're actually doing. The only time I see the number go up and tell me that it's doing a lot is when we have smoke. When we have like forest fires, then it'll show
Oh,
that it's
so they're
filtering out a bunch
detecting
of air.
something. So that's actually nice, I guess, that they're kind of working,
Yeah,
I would
they're
imagine.
they're there to give warm fuzzies, and that's what they do, and we still have them.
So I was going to ask you this also, like, what do you think are like the biggest problems facing dentistry right now? Because we've been in practice for a while. I think times now are different than 15 years ago. There's corporate, there's so much stuff going on with dentistry. There's fluoride issues. Like, should we not? I mean, do you guys have fluoride in Eugene? I don't even know in the water.
No, we don't.
I don't actually, Oregon doesn't, I don't think, right? Oregon is not.
There a few cities do. I think Corvallis has it. I thought I heard
Oh,
Salem
okay.
does too, but I don't know. I always say like we have tons of people come up from California, go to University of Oregon, and their teeth are perfect. They don't have any cavities. They have fluoride down there. The dentist looks so bored because they're putting sealants all the way up to like the first premolar because there's
Hmm.
nothing for them to do. I don't know. I mean, I know Idaho just got rid of fluoride. And there's tons of dentists in Utah. And it seems like it would behoove them to not have fluoride so they don't have to be so competitive. The thing I don't really understand with dentistry is like the reimbursement rates aren't going up. And my
Yeah.
staff, they all know that the reimbursement rates aren't going up. And I know that, we're having the Strait of Hormuz, we're going to probably get to some economic downturn soon. And, but also inflation's going crazy. So everybody wants to get paid more. But I'm also like, there's no, like, the money that came in this year is the same money that came in last year, unless we produce much more and get another operatory. And I think about my son, he was like 6 years old and he wanted to be a dentist. I've never told him to be a dentist, but I'm sure he wants to because of me. And I was like, what's the is it still gonna be $1,500 a year when he goes to dental school in 20 years from now? Like, I don't know how we're gonna like
How does
make
that
this
work?
work.
How does the math work? Right.
Yeah.
I
And
mean, if you
especially
come
like,
out of school with a 600, $700,000 of loans.
right. There's a new residency. I think it's only been out for 3 years. Oral medicine, right? Oral facial pain. I don't, I've gone to some courses where they're teaching and they'll be like, yeah, we just changed and put this patient on gabapentin instead, or we changed these doses and then they got much better. And I'm like, how do you pay for your rent? Like, if you have this much student loans and it's not a high producing, I don't know, maybe you're
So
doing a
Bert,
night guard for $4,000.
you got to marry rich. That's what it is.
Oh, I know it's too late for that. I'll just tell my kid to do that. But
Yes,
yeah,
that's
I
fine.
don't know.
They'll
Like,
solve your problems. Yeah,
I
too
feel like the
funny.
oral surgeons always end up marrying the orthodontist in residency. Is that true to you at all? Or
I did marry a physician, not a dentist, but
okay,
a physician. I'm not married now. I'm single. Ladies, call me.
put it out there.
But yeah, how do people find you? Like I found you on social media. Like what? Like is your Instagram, your TikTok?
Yeah, I post on Instagram and TikTok every day. It's just at Bert Walpack. There's no other Bert Walpack, as there is no other Sir Wahan. It's
There
just
is
I'm
not.
the only
There
one.
is not. There is not.
So please feel free to reach out. I love when people DM me with questions. It's my favorite thing to see a question.
Nice.
It feels really good.
DMs are it's a full time job. Like when I first started Instagram like 4 or 5 years ago, people were like, "Yeah, if you answer your DMs, it helps your algorithm. It helps promote your own content." And maybe it does, maybe it doesn't. I guess the Mosseri came out and says DMs don't do anything now, so I don't know what the hell's going on. I always responded to almost everyone I could, just be in the beginning, and even recently, just because I thought it helped the algorithm. But I'm not sure anymore, so I don't know.
Oh, I love like doing the stand-up shows and getting to meet these people, getting to meet fans. That's great. But I do a lot of like funny reels of dressing up like a woman and stuff. And I'm always
Oh yeah,
surprised that the DMs I get are very serious. Sometimes they're like, "Hey, I'm a general dentist in Spartanburg, South Carolina, and I broke an implant off. How would you retrieve this in your office? Any recommendations?" Would like
after
what?
you just saw your like Sharon reel or something. Yeah, that's funny. That is hilarious. Like they trust you. Like that's like a trust factor then, right? Because that's crazy. You're
Yeah,
not
I was
doing
like,
anything clinical in your video, and then
nope,
like, how would you treat this? This lichen planus.
right.
I don't know. But yeah, I get a lot of that treatment stuff. A lot of that treatment stuff. I'm like, how would you treat this case? This is what I did, and it'll be like, I look at the thing, and the Instagram has like all these photos overlapping. I'm like, that's like a lot of photos for me to like look at. And then once you look at them, it's like he's seen it. And I'm like, do I just leave him on red? Do I have to respond? Like, it's a lot of stress, man. I don't know.
There was a good one, a dentist from he just finished dental school in Baghdad in Iraq, and he's like, "Do you think I should stay in urban, stay in Baghdad, or should I go rural? Because my uncle has one out in like this part of Iraq." And I was like, "What? You've seen my videos? I don't do anything like that."
First of all, Iraq, I have no idea, but yeah, that's hilarious. But man, I really want to thank you for coming on, man. This has been fun. A lot of
Great for
fun.
me. I'm glad I finally got to meet you, albeit virtually, but someday I'll meet you in real life.
Oh yeah, I mean Washington, Oregon's not too far. I'm sure we'll connect. I don't think there's any major dental conference. I know your guys' Oregon conference isn't great, the dental one,
No, it's
right?
not great.
It's not that great. Yeah. We have one, the PNDC here. I could think it's decent for a dental conference, but I don't know.
Okay.
But that's really the only one I go to. That's general dentistry now, but I only do it to network. I don't even go to the lectures or anything. So.
I know. I usually like I'll go for the first class and then I'll see someone from dental school, make you want to get lunch, and then 2 or 3 beers later, I was like, let's just go tomorrow morning to the next one.
Yeah.
It's just like reunions.
No, I get it. I get it. But I really appreciate you coming on a weekend, taking your time, man. Thanks again.
Yeah, thanks, Serv.